Thymoma is a type of tumor that originates from the epithelial cells of the thymus, a small organ located in the chest behind the breastbone and in front of the heart. Here's a detailed breakdown. 1. Definition: thymoma is a relatively rare tumor that develops in the thymus gland. It's usually considered a slow-growing tumor, but it can be locally invasive and may spread to nearby tissues or organs. 2. Epidemiology: thymoma can occur at any age, but is most commonly diagnosed in adults between the ages of 40 and 60. It's slightly more common in men than in women. 3. Pathophysiology: the exact cause of thymoma is unknown, but it's believed to develop from abnormal growth of the epithelial cells in the thymus gland. There may be some genetic predisposition in some cases, but the majority of thymomas occur sporadically. 4. Classification: thymomas are classified based on their histological appearance using the World Health Organization (WHO) classification system. This system categorizes thymomas into different types, ranging from type A, least aggressive, to type AB, B1, B2, and B3, most aggressive. 5. Symptoms: thymomas can be asymptomatic and are sometimes discovered incidentally on imaging studies performed for other reasons. However, they can also present with symptoms related to compression of nearby structures, such as cough, chest pain, difficulty breathing, or superior vena cava syndrome, SVCS, if they compress the large veins in the chest. 6. Diagnosis. Diagnosis is typically made through a combination of imaging studies, such as chest X-ray, CT scan, or MRI, and biopsy. Biopsy is necessary to confirm the presence of thymoma and determine its histological type. 7. Treatment. The main treatment for thymoma is surgical removal of the tumor, often along with the entire thymus gland, thymectomy. The extent of surgery may depend on factors such as the size and location of the tumor, as well as whether it has spread to surrounding tissues. In some cases, additional treatments such as chemotherapy or radiation therapy may be recommended, particularly for more advanced or aggressive tumors. 8. Prognosis. The prognosis for thymoma varies depending on factors such as the stage of the tumor, its histological type, and the success of treatment. Overall, thymomas tend to have a relatively good prognosis compared to other types of cancers, with high rates of long-term survival, especially for early-stage tumors that are completely resected. It's essential for individuals diagnosed with thymoma to work closely with a multidisciplinary team of healthcare professionals, including oncologists, surgeons, and other specialists, to develop an appropriate treatment plan tailored to their specific situation.